Welcome back. I hope you had a chance to get a coffee. I know some of you probably didn't get a chance to get out of the door, but if you didn't this time, make sure that you do visit the exhibitor booths during the lunch break. But at this time, I'd like to take a moment to thank more of our many sponsors. The Alex Panton Foundation would firstly like to recognize our premium sponsors, Butterfield Bank Cayman Limited and Tower, and our media partner, Stingray Media. We would also like to show gratitude for some of our gold sponsors, Doctors Express, Greenlight Reinsurance Limited, Integra Healthcare, Ministry of Education and Training, Ministry of Health, Environment and Sustainability, and Ministry of Youth, Sports and Heritage. We truly thank you, all of you, for your support. So as promised, next on our agenda is Dr. Stenette Davis, Consultant Psychiatrist at Integra, who's going to be presenting on improving mental health outcomes in teens and young adults. Very fitting topic after the morning presentation. So join me in welcoming Dr. Stenette Davis to the podium.
Hi, good morning. So I must say, so far this has been a very wonderful session, and I was particularly moved by some of the things I heard today. Hopefully I can match up to the pace that has been said so far. And so without wasting any more time, we'll be looking to that. Improving mental health outcomes in teens and young adults, right? So I always like to start with a disclaimer. Some things I may say, you may not agree with, right? But anything I'm saying is just to bring forward a discussion. And I will never forget one of my seniors when I was doing my training. She said, "What you said wasn't wrong, but I didn't like how you said it." So as much as possible, I'm going to try to say it in a way that most persons find that they can accept. All right, so today we'll be focusing on just having quick discussions around what is a symptom versus a disorder. We'll discuss how poor mental health in our teens and young adults impacts families. We'll be looking at the impact of the community, and these are two-way relationships, right? We will look at how mental health affects learning in school, and to discuss common mental health conditions in teens, to review some simple and effective approaches in building resilience. And remember this word, resilience, because this is the crux of this talk, resilience. And finally, we'll speak briefly about destigmatization. All right, so it's very important to understand the difference between a symptom and a disorder. So a symptom is defined as a noticeable change in a person's, for mental health sake, right? Change in emotion, thoughts, or behaviors that indicate distress or difficulty coping. So you can have multiple symptoms and not have a disorder. The key thing to have a disorder is that you must have a change in how you're functioning, right? So for example, if I didn't sleep well last night, I could say, okay, I am sleepy now. But even if I'm sleepy, I'm able to come here to do this presentation. But if that was my state every day, and I was so sleepy this morning that I had to call and say, I couldn't come, I can't do this presentation anymore, then we're looking at a disorder, because now functioning is affected, right? And so the World Health Organization defines it as a clinically significant disturbance in an individual's cognition, ability to think, emotional regulation, or behavior. And it's usually associated with distress. So most persons, if they're having some form of disorder, they experience it too. But what is also true, it will affect persons around them. And so that's definitely important to remember as we continue our conversation. So we can have issues like substance use disorders, anxiety disorders, depression, and neurodevelopmental disorders. And we'll speak more about these later in the presentation. So Oftentimes, family members will bring their child for care, and they will start by listing everything that is going wrong with the child. But I'm going to ask you a question. The answer is very simple. Can you help the child without helping the family? Do you think a child's symptom is always just belonging to this child, or do you think it's also impacted by family? Good. So that's a good start. And I'll give you a quick story. The first patient I encountered in the child guidance clinic at the university hospital was a young lady I was not prepared to see. So I'm talking to her, and about 5 minutes in, she gets very upset. And she's just expletives as the worst descriptions for me. And I'm like, okay, I've never experienced this in my life. Bring in the mother, and the mother tells a story that this behavior has been going on for a while. And recently I was called to say that she was in a certain area. And I said to the mom, so what did he do? She said, I got here and I beat her, of course. I said, okay. Have you ever beat her before? She says, yes. Did it work then? No. Why would it work this time? And the mother, so it's me is the problem? And I hear more expletives, right? But she was unwilling to accept that the beatings that she's been doing is not effective. And she has not listened, as Jana said, to figure out, well, if she keeps on behaving like this, there must be something deeper. And so she's not listening to me or the kid. Oh, wait. So I want to make this presentation as evidence-based as possible, right? So I looked into the literature, and it highlights, so this is Kuhn in 2014, and he pointed out that poor family functioning is likely to lead to deteriorating health in young adults, because oftentimes, and every mental health professional will tell you this, family members will come in, parents are having conflicts, other persons are having conflicts, and if you ask what is wrong, they'll say, this kid is not functioning. They will never volunteer all the things in the home that are contributing, and that's information that becomes very critical. And so this study additionally found that adults who have poor mental health, right, will likely impact the family in a way that others have deteriorating mental health. But it's not all doom and gloom, because another important point is that when family members receive the support that they need, it decreases the distress in the adolescents as well as the family. So in my talk, I will point out issues, but I'll also point out solutions. And so a key part is that if we want to support teenagers, we have to make sure that the families are supported as well. So Boehner in 2021 also reported that behavioral and emotional issues in teens increase family conflict and issues. So again, we're seeing it occurring two ways. If there are issues in the family, it impacts the teen. But it is impossible for your child who you love to not be functioning, and you're like, meh, moving on, right? You're going to also be affected emotionally and in other ways. So the important point from this study is that even though the children were having difficulties, parents still continue to love the children even though this was going on. And they found from the study, once you increase parent support, there was less conflict, and the family was more likely to stabilize or be stable. And again, what's the point? You cannot help a child without helping the family. Getting it so far? All right. So it was almost poetic that the Chief Justice, is she gone? Yeah, brought up ADHD, because this is one of the more common conditions that we're seeing in children and adolescents now, right? So autism and ADHD are two conditions that are on the rise. And so we look at this study that spoke about persons experiencing. So parents of children with ADHD are nearly twice as likely to divorce by the time their child is 8 years old compared to parents of neurotypical children. And does this sound alarming to anybody? Because when we think about ADHD, we just think about a child running up and down, right? or a child not paying attention. But why would that child just running up and down and not pay attention lead to so much distress in the family? But it's more than that. ADHD affects a lot of things. It affects emotional regulation. It affects whether or not I think you have a big head. Okay, but it's not the appropriate setting to say it. I can think it, but I don't have to say it. When someone has ADHD and it's severe, the filter goes, and the first thing come to their mind, they say it. So they may have a disagreement with parents, and they will say, I hate you, I wish you would die. They don't mean it, but that was the first thing that came to their mind, right? And so when children also start to fail in school, parents often want the children to succeed because the children is a reflection of them. So if my child is failing, it causes me distress because he ran out of class again. He told the teacher some bad words. He's going to be suspended. Chief Justice said what? She was living at school. Every day she had to be at school. So you have to be missing work. If the children are sent home, can you just say, okay, I'm going to leave this 9-year-old at home by themselves? Not really. And then your job is going to say, I think you're a good worker, but we can't pay you to take care of your kid. We get it? So it has wider ramifications than just the disorder itself. So a Danish study similarly found that parents with firstborn children with ADHD are 75% more likely to experience marital dissolution within 10 years, and that's in 2023, right? And parents with children who have ADHD tend to have more mental health problems. But again, it sounds like a lot of doom and gloom. But the other side of the coin is that ADHD is one of the most treatable conditions in mental health, and every psychiatrist here will agree with me. If you have someone who has clinical anxiety or depression, and they go and they say, okay, I think you need medication, then the psychiatrist, but you have to wait 2 to 4 weeks. Right? 2 to 4 weeks before you start to see the benefit of this medication. But if I give you a medication to treat your ADHD and it's the right medication, how soon do you think that start working? 30 minutes. Literally 30 minutes. So it's one of the most treatable conditions. So if we start to come to the point that, this is a very treatable condition, and stop saying this is a fabricated diagnosis and doctors just want to diagnose the children, we can get better functioning for the child, which gives the teacher a better life at school, right? I hear the teachers clapping. And I had a parent, she said, the life is even better for the dog, right? So, again, we're making the point that if we treat this thing, we can better families, better communities. All right, so let's look at the level of school. So in the United Kingdom, it was reported that children are spending about 32.5 hours in school per week, about 6.5 hours. Here, I think we have 8 to 3 p.m. That's our 7-hour school day, right? But if we factor in everything, if you're coming from North Side, or if you're coming from East End, can you be at school in 5 minutes? No. You have to be waking up from 5 o'clock, right? And you have to factor the journey back. So you'd spend 7 hours in school, 6 hours of the day's journeying. So that's how much we reach now, 13. We're going to try sleep for 8 hours. 8 and 13 is 21. How much hours do we have left? 3? But what is that 3 hours for? Homework. Where's the life? Is that stressful? But we say all the time, teens have lives easy nowadays, right? We say it all the time. You know who's guilty? Tell my son that all the time, what you're worrying about, your life is easy. It's not true, right? So we have to consider what is the intensity of experiences children are having in a school environment and how that will impact the mental health, and we'll speak about that soon. So the U.S. National Center for Education has noticed that the persons graduating, they're also increasing the complexity of subjects they're taking on. So one is the number, but also the complexity. So advanced algebra, biology, chemistry, and physics, those things require a lot of recall power. It takes a lot of critical thinking, right? And of course, the more difficult a subject is, will you feel more at ease or more stressed? More stress is a lot of information to cover and is a lot of information to retain. Additionally, a lot of schools are moving away from coursework contributing to final grade. And so you can imagine you go to school every day, grade 7, grade 8, grade 9, grade 10, grade 11, and every morning you wake up in Eastern, 5 o'clock, and you go, and you've been doing coursework, you've been doing assignments, so saying, yeah, none of that don't matter. But you failed all the CXCs. What was the point of all of that? Who was that for? Feels like you wasted your life, right? And so these are the realities, and if we start thinking about it like that, then we have to start looking and saying, maybe even the way that we graduate our children need to change. Because it is saying that none of the effort you put in over the last 5 years don't matter unless you were academically gifted. Because here's the other side of the coin. Not everybody's built the same. Some children are going into CXC with an IQ of 120. Some children are going into CXC with an IQ of 89. You think they stand the same chance? No. So when we start to look at it like that, we have to look at wider systems, just like the justice is saying. We have to look at how the systems are impacting the children as well. So CXC is recognizing that, okay, we need to do things a bit differently. And CXC is now moving towards more modular kind of pathways. So the subject is broken up into modules, and the person is exposed to each module. So even if you don't have the cognitive proficiency as other persons, the simpler module, you could realistically succeed, and you get a certification. And you get a cumulative amount of certificates, and that determines like your final outcome. And I think that's a very useful system to think about. So the National Education Union also highlighted that the reform curriculum that they have given students require you to memorize much more. But let's make the point again. Your ability to memorize a large amount of information is dependent on your IQ. So it's not fair to everybody involved. And so we have to look at, are some persons better suited for an academic pathway? Are some persons better suited for a vocational pathway? And at the end of it, what are their possibilities? So that they wouldn't have been spending the last 5 years spending 6 years to travel to 6 hours to travel to school without anything to show for it. So even in the US, Stanford did their study and they found that the high achieving schools, persons were in school for what? 7 hours, right? And they were doing on average 3 hours of homework. So just school alone, 10 hours. Put in sleep. How much sleep we're getting? 8 hours sleep. 18. How much time is left? 6 hours. Right? So it makes the point that school is very stressful, and how school is set up is leading to significant distress. The Organization of Economic Cooperation and Development reported that curriculums have expanded, and this is a funny thing. So we're putting more in, but we're not taking out anything. Is that fair? I don't think so either. And so students are spending a lot of time feeling distress. So, as early as 2014, Fieldies et al., this is an Australian study. They had about 13,900 participants. And in the study, they reported that academic or school-related stress was a top contributor to their mental health stress. About 40% of the respondents noted school as a top reason for feeling distress. And similarly, in UK, they did their study and they highlighted that academic pressure was one of the most reported. So this, if you see the word coroner, it means that the person has passed on. And so when they did their study and they looked at it, persons who completed suicide listed academic pressure as one of the most significant stressor or antecedent to suicide. So that's everything to say, but just for us to kind of get that, and then when we come to Cayman, you will see what our rates are looking at, like based on the sister study. So academic pressure potentially is modifiable. So we pointed out the problems, but we can look at the solution. So academic pressure is modifiable. And so in this study by STEER in 2023, this was a very large study. They looked at 100,000 participants. And they found that if you modify the academic pressure, that also leads to improved mental health outcome in our children. So the pandemic was very instructive, because we'll send our children to school and say, the teacher's not doing enough. The teachers need to do more. The school need to do more. Any teachers ever heard that? And then the children had to stay home with us, and we're like, we need to get rid of these children. So we know that being in an environment cooped up with a kid for 8 hours is very difficult for the kid, but it must be difficult for the teachers too, right? And so during that time, we started to see the impact of the mental health impact in our children. And so the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association was emphasizing that we need to prioritize mental health in our teens. So I was very happy to hear the minister say that is one of the priority areas, right? So there's a dual relationship going on with academic aspirations. So for persons, and clearly these are the persons who have the higher performing IQ. These persons who had higher aspirations, keep pressing the wrong button, sorry. So persons with higher aspirations had better mental health outcome. And persons who had poor academic performance were more likely to have mental health issues. So if you had high aspirations and you succeeded, you would feel good, right? But if you didn't, what's the challenge? But it goes back to the same problem. If we're doing the same qualifying exams and I'm like, okay, I really want to pass, but I don't have the cognitive functioning to pass these exams, what is the clear setup there? For you to be distressed, for you to feel, I failed. But if you have the good IQ and you have the support that you need, you pass it and you say, yes, I'm the best thing. So, this is a peer-reviewed paper in 2024 that was published in the Journal of Pediatric Research. And so what they did was they did a review of the literature to look at best practice. And these are some of the suggestions that they made. Increased funding and support for access to meaningful, that's the emphasis, meaningful mental health resources in the community would improve mental health outcome. Integrated behavioral health delivery models within primary care and specialty care will be critical in enhancing access to care. It's a very loaded, fanciful sentence. What is it saying? It is saying that most times when persons go to access care, they're either going to the general practitioner or a specialist. And so the specialists and the general practitioners need to be able to deliver some mode of mental health care or have the knowledge base to pass on the person. Because here is something that is interesting. A child is not going to say, oh, take me to the doctor, I'm feeling anxious. The child will say, oh, I don't want to go to school, my belly is hurting me. My head is hurting me. My heart feels funny. And then the parents say, oh, no, not my child's heart. And so they bring them to the cardiologist. The cardiologist says, nothing is wrong. And that's the end of it. But the person is experiencing symptoms. Where are these symptoms coming from? They're having migraine, and you're treating the migraine. It's not improving. Right? So if we have the specialists, like the cardiologists, pulmonologists, pain specialists, have some integration with mental health services or the primary care, we can improve that. So this is something that has been tried in the adult population. So Pan American Health Organization and WHO came up with a program called MH-GAP, Mental Health Gap. So they recognized that most persons accessing care for mental health issue weren't going to the psychiatrist. They were going to the general practitioner with symptoms like lower back pain, headache, and insomnia. But if those doctors took the time to properly screen them, a lot of those persons met the criteria for depressive disorders. So they started to train the general practitioners to say, if you identify these things, you too can prescribe. And so it's that kind of intervention where primary care, specialist care integrate with mental health care, that even if they're not coming to mental health providers, persons can get the care they need in the community. And so if it's good enough for adults, it's also good enough for our younger ones, true? Because the younger ones will become the adults. So the best place to stem it is there. It's not to wait until they're adults when it's years of distress and stress and academic failure and other kinds of failure. So another important point that they made, and this is something that now has to be like a country level, policy level, to increase behavioral health workforce. That means psychiatrists and non-psychiatrists, psychologists and non-psychologists. So increase the workforce, increase training program, and because, again, pediatricians are the ones interacting with persons in this age group, by improving their skill set, we can get better outcome for these clients. So working at Integra, we see the benefit of that. So Dr. Bugembe is a pediatrician, but she recognized the need, as we've seen more and more persons with ADHD. So she put an interest in it. Dr. Balang sees a lot of the teens, and she's realizing, oh, we're seeing a lot of mental health issues. So she puts interest in it. And so even if you're not a psychiatrist, by being interested in it, developing your clinical competence and collaborating, we can get better mental health outcomes for the teens, so that the teachers can have a good life, so that the family can have a good life, and so that K-Man can be the K-Man that we want it to be, right? Because this is where we have to put a lot of the effort. Their success now means success for K-Man later. Right, so the information on this slide comes from the World Health Organization. So globally, 1 in 7 persons between the age 10 to 19 experiences a mental health disorder, not symptom, disorder, accounting for 15% of the global burden of disease in the age group. Depression and anxiety and behavioral disorders are among the leading cause of illness and disability among adolescents. Suicide is a third leading cause of death amongst persons in this age group. So again, when persons go for a routine visit, our teens, no one is asking them, are you having symptoms of depression? Are you experiencing anxiety? Are you having thoughts about hurting yourself? Because one, that's not an easy thing to bring up. And if I've asked the kid and the kid starts pouring out their heart to me, what do I do next? And so that's where the collaboration comes in. So I've seen here, general practitioner sees someone and gets some information. They're like, I don't know what to do. Can I send the person to you? Yes. And so that's the interlinking collaboration between private and private, private and public, within public as well. Those are the kind of interactions that we need. So the consequences of failing to address adolescent mental health condition extends to adulthood. Clear to see, right? Impairing both physical and mental health and limiting opportunities for living a fulfilling life. So this is a good point to start. So in our Cayman Islands survey, this is the Cayman Islands School Drug Use Survey in 2024. It highlighted that 1 in 4 students in years 9 to 13 reported that they have seriously considered attempting suicide. Right? And so again, nothing I'm presenting is to alarm. It's to inform. And so this is not, oh, these children. It's more like, oh, that must be difficult then. It must be difficult in the classroom. It must be difficult in church. It must be difficult on the bus ride to school. And so if we start seeing it that way, then our thought process is like, how do we form a coalition to help these persons. All right, so I'll speed past this, but we get the point that the mental health issues in the community are very real. So, what are some of the most common disorders? Anxiety disorder, most common mental health condition worldwide, in adults, in children, in everybody. Because your brain is designed to look for danger. That's how we survive. If we said everything was okay, we wouldn't try. We just stay at home in bed, just watching Netflix all day. What is there to worry about? But the thing that says something is wrong if you do this, there is some danger. We need to pay attention to that. But that system can continue to signal even when there is no danger. So that same system that operates in us would have been the same system if we were in the jungle and a lion was chasing us. And that would feel very dangerous, like you're about to die, right? So when someone is experiencing significant anxiety, that's the same system that triggers. And to you, you're like, just calm down. They feel like they're dying. And you're saying, you just need to calm down. You see how the two things don't correlate? And what did Jane say? Or Mrs. Panton, rather, sorry. You have to listen to understand, not just to offer an opinion. Right? And depression, substance abuse. So substance abuse is one of the tricky things. Because the children who use substances in school are the bad kids. We don't ever say, wait a minute. When I was going to school, I didn't smoke. I had coping mechanisms that I didn't need to use it for. But two main things. If someone is using a substance, they're trying to remove negative feelings, or they're trying to add positive feeling. So if you see someone smoking, it must be for a reason that feels legitimate to them. And so if you can come from that perspective, and so I'll just do a quick segue, hopefully we have enough time. In the Jamaican system, they had criminalized enough young persons that it created a significant issue when persons were to go away for like farm work programs or family members were filing, they couldn't go because they had a criminal record. And that became a financial issue for our population where a lot of the young people were unemployed. So they said, okay, this is not working. Let's have a diversion program. So when someone is found with marijuana and they don't have a serious criminal offense, they're put in a diversion program. And I met one of those gentlemen. And when I spoke to him, why do you smoke? I saw my family murdered before me. Oh, okay. So what does smoking do? Can't sleep without it. When I smoke, the images come out of my mind. And suddenly it's not someone who is doing something illegal. It's someone who is having significant distress and have found a way that doesn't require going to the doctor. And so when you create diversion pathways, persons can get the help that they need. And the persons involved in the diversion pathway can get a better understanding of the behaviors they're seeing. So the teenage population is pretty unique because the brain is still maturing. One of the things that teenagers crave above all is to feel a sense of community, a sense of camaraderie, right? And they're trying to manage their emotions. So what does that look like? Conflict with adult, because Jane said there's a party at her house, and I want to go, but you haven't completed your studies. If I don't go, no one will invite me to another party. That triggers my anxiety. It means that I feel like I'm going to die. And for you, it's very simple. So what if you don't go to Jane's party? So what? It's the worst thing that could possibly happen. No one will want to be friends with me, and I'll be a loser. May as well kill myself. And if you've had a teenager, you will know the move from, this is a simple conversation, may as well kill myself. Because it feels that life-threatening. And if we listen to understand, we begin to see it differently. I'm getting the speed up signal. Right? So the academic pressure we mentioned before, the interpersonal relationships we're striving to keep going. So how do we help? Building resilience. This is extremely important. Resilience building starts from very early. And I don't want anyone to think you can compliment someone and tell them how wonderful they are for them to be resilient. If someone is feeling depressed and you say, oh, you look nice today, they say, so that means I didn't look nice yesterday? Right? So it's the way the thinking becomes very different. So creating opportunities for children when they have a difficult situation to resolve it is the kind of thing that builds resilience. Making sure that children can play, because that's something that has decreased over time. If children play, they will have conflict. And you know what they'll have to do? Resolve it, because they love to play. They'll continue to. But children don't really play like that. I will organize a play date for you. And it's supervised. And the minute one child pops off, they're like, okay, let's go home. Conflict is not resolved. So this is a short list where they look at multi-system for resilient factor. If you start by looking at the top, you will see sensitive caregiving. So there's a role for the family. Sense of belonging and cohesion, there's a role for community. Self-regulation, there's a role for self. Systems are governments, right? But if you look at most of it has to do with the person. And so a lot of parents believe that the more you compliment your child, the more things you put them in to build their character, that will make them resilient. If I feel like I can't do anything and you put me in 3 activities, it makes me feel like a failure 3 times. So, how can we build resilience? We're doing some things right in Cayman. So, part of building resilience is building emotional intelligence, right? And so we have the Alex Panton Foundation has very important initiatives like Zippy's Friends, Sunshine Circle, Spark Resilience Group. Alex Place is our wonderful, I don't want to say invention, but the fact that it's there and you can just walk in and access care. So one of the important things is the ability to access care. And the Alex Panton Foundation provides other things like financial assistance. And so you can look at the others because we're pressed for time. And other stakeholders in the community, the Counseling Center and Family Resource Center provide very important resource and support for the community. The National Drug Council, who does the research, that can influence a lot of policy. I remember the Chief Justice saying we need safe spaces, so Tire Lounge is a safe space. And of course, educational psychologists and mental health professionals in school is very much needed and wonderful. If that can be expanded, that every school can have an educational psychologist, that would be very good as well. So, you do not have to have a mental illness to seek mental health care. And I just want to make that point quickly. And some persons will think that, and they will not come because they say, I don't have a diagnosis. But why would you wait until it reaches a diagnosis? If we're seeing symptoms, that's the best time to get intervention. ADHD is one of the most treatable conditions. I'm glad that the Justice mentioned it before. It's the difference between massive success and abject failure. And we have persons who've moved from ease to ease. And I literally had a client who was failing, started ADHD treatment, and then moved from ease to 2 A's and a C in their A-level. So it is that kind of a difference. Fighting stigma locally here, I think having Alex Place is one of the biggest tool in fighting stigma by making mental health services readily accessible, where you don't have to go through the waiting of sitting with adults and being in a very, if you've been to Alex Place, the front is very beautiful. Being in a nice, relaxing space, persons feel like, okay, this is somewhere to come to get help. So those kind of things make a big difference, right? We need to look at insurance coverage because, again, there is some stigma when you look at insurance coverage. Persons will be covered for physical illnesses, but insurance companies do not pay for mental health services. And one of these things not like the other. And that's what stigma is. We need to look at government policies for everything we mentioned before, looking at the school curriculum and what our children are doing. And of course, the church will play a role. We need to stop shaming psychiatric treatment. We need to stop shaming psychiatrists. I remember when persons found out I was doing psychiatry, they were like, but you're bright. So the thinking is that psychiatry is a default profession, right? Pseudoscience gets through much better than us. So you'll go on TikTok and they're like, oh, for autism, here's a detox. And persons are more likely to buy the detox than go to the doctor. So we need to police those kind of things in the community as well. And the fight for stigma is with everybody, not just any one person. So my final words, building resilience is the number one tool in terms of fighting mental illness in early life. In fact, the study said, regardless of the adverse childhood experiences you've had, if you are resilient, that is a protective factor always, right? Improving parenting skills, training, and support lead to better mental health outcome as well. Schools have a critical role to play because teachers are interacting with children 7 hours plus per day, so they play a bigger role in the children's life than the parents, right? And 6 hours on the bus, so the bus warden is playing a part as well. We need to look at insurance coverage. And finally, I'll say everyone listening to this presentation, the information is the fire that will light your torch, right? And then know that your torch is lit. You can light every torch because stigma is the darkness in the road to good mental health outcome. And this is how we provide hope.